Fabulous. So again, thank you for joining us. We, as I mentioned, so many people here tonight. And what that says to us is that this is an issue that is such a challenge for so many people. So, free fecal water, manure problems. It also tells us that we as horse owners are so dedicated and we just want to try and find solutions, which is why Poseidon is so committed to not just delivering amazing evidence-based supplements, but delivering information, education from people qualified to do so. And the other thing that makes us really excited is that every time we have a webinar, we're getting more people sign up. It's fabulous because what it says to us is that we're delivering the information that you need, and our reputation for providing these webinars is growing. We have had a lot of new people sign up, particularly all across the USA. So thank you for taking the time to join us. And we know you're going to learn so many things. Now, just a shout out before we start looking at what we're covering is to stay around to the end, because we have an incredible prize to give away. We'll talk also later at the end about our partner, KBC, who have been incredible in partnering with us in this webinar, and we're really grateful for that. So there is a fabulous prize to look at that we'll be giving away at the end. So let's get started.
Let's get started. My move slides. Sorry, our fancy slide mover has died on us. Here we go. All right, it's okay. Linda and I,
In the background.
Linda and I know a lot about horse poop, and our brains are full of that, and that leaves no room for anything about a computer.
Absolutely.
So, if you were here to learn about computers, you're going to want to find a different webinar that we can't help you with.
What you will get today is, obviously we're focusing on manure. And what we do know is that, again, the number of registrations is telling us this is a problem in so many ways. You are going to be so blessed to have the incredible team I'll introduce you to in a moment that can share their insight. What we want you to do is go away and you come to this webinar feeling frustrated and confused. And a lot of you have been trying to manage these problems for a long time. Ideally, by the time the webinar is over, you're feeling confident and you've got a really clear plan of action. This webinar is not about us selling supplements. It's more than that. It's about how do we feed correctly, how do we manage our horses, and then what is the right and correct use of supplements. So we're covering manure as an indicator. It's like there's so many reasons why we need to be looking at our horses' poo every day. What is diarrhea and what is free fecal water versus diarrhea? And that can be really confusing because they are different. We'll look at the causes. We'll talk about how's the microbiome connected, and that's a really fancy word to talk about all those trillions of microorganisms that literally determine whether your horse is healthy or not, and its behavior and all those things that go with it. We're talking about functional nutrition and then going beyond a balanced diet. So much to get through, so much amazing content. Before I hand it over, I'd just like to introduce the team. Oops, here we go. I've already introduced myself and
A little excited.
sorry. As I mentioned, I'm the founder, and Poseidon Animal Health is just the most exciting, I feel, gift to our horses, because we're really about putting gut health on the agenda and sharing our love of education and really making a change. And all of us involved in Poseidon just want to make the world a better place for our horses. And we understand we do continue to put stress on them. We want to keep riding and traveling, competing and doing all those things. But how do we manage the stress and the impact that has? Joining me is Dr. Erin Roddy, and I've been blessed to work with Erin for quite a number of years, and she truly is a world leader in gut health. So would you like to say hello?
Thanks, Linda. It's very exciting for us to be in the same room doing this. That's pretty cool. Thank you, everyone, for turning up. I hope we're going to give you a lot of information tonight. And I just want to say a thank you, obviously, to Poseidon, but also to KBC, because companies that want to get involved in education, particularly free education, I think is really valuable. And I hope everyone who's tuning in appreciates that. And I really appreciate being given the opportunity to give that education.
Yeah.
So thanks to Poseidon and thanks KBC.
Yeah, excellent. Thank you, Dr. Erin. And also we have Dr. Tiffany Hall, again, and the most incredible vet that brings so much expertise to the team. So Tiffany, we just want to jump in and say hello.
Yes. Hi, how are you guys? I am in Lexington, Kentucky right now working. So excited to see all these multiple people from all over the US on the webinar tonight. It's great.
Fabulous. And we're looking forward to your amazing presentation. I've had the pleasure of working with Dr. Tiffany on quite a few, well, we have quite a few webinars, and You never stop learning, and I guarantee that you will be learning lots tonight. So take notes. We will be sending out a recording. So if you have to leave early or you're just getting so excited, you're so interested, you forget to take notes, don't worry. We've got it covered. We'll be sending them out. And finally, we have Dr. Clair Thunes, who is the most amazing equine nutritionist, because she has this incredible knowledge and qualifications and experience to be delivering information and education that we all really need. So, Dr. Clair, do you want to jump in and say hello?
Sure. Hi. Yeah, it's great to be here. It's great to be back and do another webinar with you guys. It's always a fun evening, and this is definitely a topic I get a lot of people coming to me needing help with. And we were chatting at the beginning in the introduction saying, oh, there's people from Las Vegas and New York and Florida and all over. And it just shows you this is not a problem that's located to one place. I mean, you mentioned, it's in hot places and cold places, and pretty much anywhere there's a horse, I think this problem exists. So hopefully we can help some folks tonight. It's a very frustrating problem to deal with. I know that for sure.
Absolutely. Thank you, Dr. Clair. I think it's my turn to hand over to you.
So obviously we're talking about manure or shit, depending on what you want to call it. And the reason that we're talking about manure is because it is such an indicator of what's going on in your horse's health. And particularly for me as a veterinarian, as most of you know, we are able to look inside the horse's stomach with a gastroscope. We can put a tube down them and we've got a camera and we can actually see inside their stomach and know what's going on. We can take samples. Once you get past the stomach, it is the wild, wild west. We really can't image it in any way that's super helpful. We can't test it in any way that's very helpful. So we are guessing a lot of the time, but we do have manure. And manure is one of the best indicators of your horse's gut health, in particular their hind gut health. And if your horse is doing what it's supposed to be doing, they are delivering you that report card every 4 to 6 hours, round the clock. So you're getting a lot of indicators of what's going on, and that's pretty real-time information. So it takes about 36 hours for food to be digested and passed out as manure, but that's actually pretty quick in terms of what's happening, how your horse is processing their food, how they're regulating the water in their hindgut and in their colon. And we often see changes in manure before we see changes in other signs like temperature, even hydration status, even the horse's demeanor. We will often see manure change first. So I think if you're not paying close attention to your horse's manure, that's something that I would love. If you take just that away from this webinar, that is a great start. But really knowing what's normal for your horse and what's abnormal is a great help and will really start to give you a sign of how your horse's management and diet are contributing to their overall health.
So, Dr. Erin, can I just jump in just to remind you, if you have any questions as we go through, our team will be answering them. We will leave some time at the end to answer any really outstanding questions, but please put them in the question section, not in the live chat. Sorry about that.
No, that's fine. That is very good information. We do try to answer as many questions as we can, and that Q&A is the spot for them. So I just want to start with some manure scoring. And this is only really important if you're going to be talking to another professional. So in vet school, one of the things that they make us pretend is that if you're on the phone with someone else, how are you going to describe this x-ray or this clinical sign? And so we need to get some words that we can all use so we're all clear on what's going on. And if you want to call your veterinarian or your equine nutritionist and talk about your horse's manure, things like cow patty and painting the walls and road apples are good terms, but having a little bit clearer scale is a little helpful. So 0 over on the left-hand side of your screen, I'm hoping, is normal manure. And normal manure shouldn't be a big problem. I'm not saying you're happy to pick it up, but it's not the end of the world to pick up a ball of manure and throw it to somebody else. Like I might throw Dr. Clair a ball of manure, and that shouldn't make her hate me. As we're going over towards the 3 and the 4s, I think Dr. Clair and I might not be such good friends if I start throwing around that kind of manure. So it is normal. The term road apple is kind of a really old-fashioned term for normal manure, but it should be fairly pleasant smelling. Remember, this is just forage that's been processed by your horse, grass and hay, and some concentrates, but it really shouldn't be smelly. It shouldn't be foul. It should be easy to handle. We don't want it dry, but we definitely want it firm enough that we can pick it up and move it around. Free fecal water, this is where a lot of people get confused, is actually sitting in that 0 to 1 range. So we should still see formed fecal balls. There should still be fecal balls that you can pick up, and they should be the majority of the pile. There will be water that will be poo colored. It won't be clear, but it will be the color of manure. And that either comes out before the manure pile is passed, it comes out surrounding the manure pile, or it comes out after the manure pile is passed. If there aren't formed fecal balls present, we are talking about something other than free fecal water syndrome. That's when we're talking about diarrhea. And it's important to be able to make that distinction, both so that you know what's going on in your horse, but also so that you can discuss that with your veterinarian or your equine nutritionist. So just for a refresher, for anybody who's forgotten their hindgut anatomy, which could be Dr. Tiffany, you know, she forgets anatomy all the time. This is your horse's hindgut. So this is all the stuff that sits behind the stomach and behind the small intestine. And in case you didn't know, or you haven't noticed from the screen, it's actually the biggest part of your horse's belly. So another one of my goals, if you already were good on checking your horse's manure and you knew how their manure looks and you're pretty confident with that, the next thing I would like you to take away from here is when you look at a horse, I now only want you to see the cecum. That should be the thing that stands out to you. When you look at a horse, you should be seeing how big and how prominent that cecum is. So the hindgut of the horse is where they ferment their fiber and their forage. And that is the horse's main job. That's how they produce most of their energy. It's how they absorb a lot of their vitamins and minerals. It's how they produce a lot of vitamins and minerals. That all happens in the hindgut. So they are really a hindgut walking around more than they are anything else. And that's where the manure is produced. So that is why the manure is a great indicator of what's going on in that hindgut. So now we've learned we're going to be really conscious of our horse's manure, what's normal for them and what's abnormal. And we're going to be really conscious of the size of that cecum. And you can imagine in comparison to the stomach, I think we're all pretty familiar and comfortable with the fact that stomach ulcers can cause discomfort in the horse and can cause behavioral changes. And when we're looking at the size of the hindgut, and particularly the size of the cecum, any inflammation or upset that's going on in those organs is likely to be as painful. So we really need to be conscious of not just what's happening in our horse's stomach, just because that's what we can see, but what's going on in all the rest of the organs that might be causing our horses either discomfort or poor health. So we've looked at what those organs look like in sort of real life, but what do they look like on the inside? It's actually not the most robust system. So the lining of your horse's GI tract is very, very fragile and delicate and sensitive, and it changes a lot. And any change is going to result in a change in your horse's health, their well-being, their performance, their behavior, and their manure, in case you hadn't caught on to the theme yet of tonight's webinar. So inside all of those organs in the hindgut, we have a layer of GI tract lining that's covered by mucus. Mucus is really important to protect that lining of the GI tract. And the production of that mucus requires a lot of amino acids and healthy microbes, so healthy bugs, healthy bacteria, to both maintain the lining and also maintain that mucus layer. Everybody thinks about amino acids as being important for muscle building, and they absolutely are, but they are important for so many other things in the horse, which is where your nutrition and your diet becomes so important, because this mucus lining is the difference between a healthy GI tract and an unhealthy GI tract. As soon as we have a compromised lining, we're going to compromise our horse's ability to manage the water in their gut. Their gut is filled with a lot of microbes, it's filled with a lot of forage and fiber, and it's full of a lot of water. And so they drink water, they eat hay, or they eat grass. And as that all passes through the GI tract, it's processed that they push manure out the back. If we have a problem in the lining of our GI tract, we have a problem in the way that we're processing our forage or we're handling our water. And that's why we see a change in our manure concentrations and the way our manure looks. So water balance in the colon. It's an active and regulated process. Remember, our horse is going to take water that they drink, they're going to take hay or grass that they eat, and some concentrates, and they're going to process that all. And at the end, we're going to get well-formed, hydrated, but not overly hydrated manure. So we're going to cook it all up in the vat, we're going to ferment it, and then we should be absorbing that water back into the bloodstream. If we're putting out more water in our manure, that's when we start to get something that goes away from that 0. That's when we're starting to get the 2 and the 3 and the 4, not our well-formed road apples. We're now getting into that range where Dr. Clair doesn't like me when I throw it in her face anymore. She's fine with the road apples, I'm sure. She's going to tell me about it later. And so that water balance is regulated through a couple of different forms. Part of that is our microbes that we've talked about, and we'll get more into them later. Part of it is the type of fiber. So if your horse isn't actually able to break down the type of fiber that they're eating, that will cause their water balance to not be correct. And that can be either that their microbes are not able to ferment properly, or that type of fiber is actually causing mechanical damage to that lining. It's scraping away the mucus, it's scraping away the microbes, it's actually damaging the cells. And then once we get below the mucus and the microbes, we actually have the physical lining of our GI tract, and that is a number of epithelial cells, and they're connected together through tight junctions. Those tight junctions allow water and nutrients to pass between the lining of the GI tract, the lumen, the center of the GI tract, and our bloodstream. So at the very end, once we've taken all of our nutrients out and we've made our manure and we're excreting what we don't need anymore, we want to absorb that water back into the bloodstream so that our horse stays hydrated. And then we want to shut those tight junctions, and we're going to poop the manure out the end, and everything that we needed from our diet, we're going to absorb into our bloodstream and then lock those tight junctions behind. So if we're having a problem in any one of these areas, that's going to result in manure that doesn't look the way that it should. So what we're trying to get to here is that if your horse's manure looks abnormal, we have a problem in one of these areas, and then we're going to have to do some experimenting to figure out which area is the problem. So what is free fecal water? I discussed it a little bit, but we want to keep talking about it because it's a very common problem, but it's also a very commonly misdiagnosed problem. So I definitely see horses where people say, my horse, they call me on the phone, hey doc, my horse has free fecal water. And I come out and they have painted the walls with very loose, foul smelling diarrhea. I'm like, that's not that, or vice versa. So as we said, free fecal water is a condition in which horses experience both solid and liquid phases of defecation. So we are normally going to have well-formed manure balls that we can pick up and handle, and then actually loose water that is poop colored because it's still coming from the colon, but it is actually free water. Versus diarrhea, where we don't have those formed balls, or we don't have very many formed balls, and the water is mixed throughout the stool. Free fecal water can present in a lot of different ways. It can be intermittent, it can be seasonal, it can be chronic. It doesn't seem to distinguish between the type of horse. We just got some really good images here. So if I was talking to you on the phone, I would classify the free fecal water as sort of a 0 to a 1. And then the diarrhea in this image is definitely a 4. And so that's a good starting place to know, okay, what's actually going on with my horse? And that will help us as professionals, whether it's a veterinarian or a nutritionist, to start to decide which direction we're going to go. And the different mechanisms that result in these different manure problems are going to lead to different management strategies. So how common is free fecal water? Well, judging by the more than 3,000 people that have signed up for this webinar, it is very common. It's seen across all ages of horses. I will say I tend to see it in my older horses, but I've certainly seen it in very young horses, all breeds, all workloads. There's some anecdotal evidence that it's more common in geldings than mares, but I also think that there are probably just more geldings that are out and about working than there are mares. I've also had people say to me it's more common in gray or paint horses. I think that's probably because it's a little easier to see on those guys. I certainly haven't necessarily found that. What I have found personally in my experience is it's often more common in horses that have a real seasonal change in their diet. So horses that go from pasture at one time of the year to predominantly hay or other dried forage types at another type of year, or if they have a move that involves that sort of change, where they've come off of pasture access to less pasture access. I do find that that's more frequently a part of the story when I hear the story. I also have some horses that have very discrete triggers. We know when X happens in their life, they're going to have free fecal water. And then I have other horses where there's no rhyme or reason to it. So I guess the good news is it's not discriminatory as a syndrome, but that can make it a little harder to treat because it can affect anybody. And typically one of the distinguishers between free fecal water and diarrhea is that the horses typically appear healthy. So they tend to not have a lot of other health issues. They are just showing these signs of free fecal water. I know that can be frustrating for owners because a lot of my colleagues tend to not be overly concerned about free fecal water because the horse is otherwise healthy. They often hold their weight well, they are eating, they're drinking, they don't have a fever, they're going about their lives other than that they have this free fecal water. But what we certainly do find is that it can lead to other health problems. So it can lead to burning of the skin. It can lead to infection. It's certainly disgusting and uncomfortable. We tend to not find it actually resulting in change in hydration status. So our free fecal water horses don't tend to be at risk of dehydration, which is interesting, because that's certainly something that I was concerned about in the beginning. But it is uncomfortable. It's uncomfortable for the horse. It's uncomfortable for the owner. And I've certainly seen cases where it causes health consequences. So the hard thing, if you were waiting for me to tell you what the secret answer to why we see free fecal water is, you're going to be waiting for a while. We don't actually have the answer, and we don't know a lot about why it occurs. That's actually why it's called free fecal water syndrome. So when we use the word syndrome, it just means a group of signs that go together. And that's the fancy vet way of saying we don't actually know what's causing this. Just a little tip for all of you guys. But it definitely seems to be associated with seasonal patterns, definitely seems to be associated with some management and lifestyle changes. And for me, I don't have research to prove this, but when we see horses that are kept in a more natural way, we usually see less incidence of free fecal water. So it is definitely related to modern feeding and management practices. As I said, some horses, it's seasonal changes. Some horses, it's particular trigger changes. Some horses, it's chronic or recurring. And what I tend to find is the longer a horse has had free fecal water syndrome, the harder it is for us to get rid of it. So it's not to say we can't, but if you're starting to notice this now or just recently in your horse, now is a good time to get on to trying to figure out what's causing it. Because once it's been going on for years and we've tried lots of things, it can be a lot harder to get rid of. Yeah, we're getting a lot of people jumping in saying it's related to hay and it's related to this and that, and that's fantastic. You're already trying to identify the triggers, which is great. So before I hand it over to Dr. Tiffany, I just wanted to give sort of the watchers an idea of what is healthy. So we're going back to our scale. So 0 would be formed fecal balls with no fecal water or soft, overly soft feces. We don't want our manure to be hard. And we tend to talk a lot about diarrhea, and diarrhea is definitely problematic. And Dr. Tiffany is going to give us a lot of information about that. But having manure that is really hard and dry can also be an indication of poor health. So the manure should be formed, but it shouldn't be rock hard. If it's rock hard, it's also a time to think about talking to your veterinarian. As we go through the scale, you can see that as the manure gets looser or as the episodes get more frequent, that's when you really want to start thinking about calling your veterinarian, because you are definitely having a health issue going on in your horse, and your vet is the best person to get in touch with about that. And so I'm going to hand it over to Dr. Tiffany, who is in the land of KBC right now, and she's going to tell us all about what we should do if we've got diarrhea problems.
Yeah, so we're going to look at this from a veterinary perspective now, comparing diarrhea to free fecal water syndrome. And I'll differ on Dr. Aaron a little bit. I think syndrome, we use it when the symptoms are all the same, but it could be a myriad of causes, right? So for fecal water syndrome, we'll kind of talk about a few of those different things that can lead to fecal water syndrome. But you'll think of a number of other syndromes I don't want to bring up because it'll open a can of worms in the veterinary world that we use too. Oh, sorry, I'm trying to use the slide mover from my computer. So let me figure this out too. There we go. So why does water separate from manure? As Dr. Aaron said, there's the normal process of our hindgut handling our feed and water appropriately, and that is a result of a very complex functionality between our gut lining, our microbiome, the food that the horse is ingesting itself, and motility of the GI tract. And so things that can alter that normal functionality or normal physiology include a dysregulated fermentation. That might be due to the gut lining or due to an alteration of the microbiome. You can have osmotic shifts in that, and what that means, osmotic is about the molecules that are inside the GI tract and causing water to go into the GI tract from the tissues themselves. And so that's an abnormal handling of that water as well. And then altered water absorption. So when our gut lining is disrupted, you can have decreased water absorption, or again, if you have those increased osmoles within your feed that keep the water within the GI tract. It's not a matter of drinking too much water. Horses can't really drink too much water aside from the effect on how much urine they produce, which can definitely be another problem. However, from a diarrhea or manure quality standpoint, it's not a function of how much water they intake when it comes to diarrhea. Now, dry manure obviously means they're probably not taking in enough water, and so that's a different topic. So how does the microbiome that we know is so very important play into this? Again, the microbiome, as Dr. Aaron mentioned, is the mixture of bacteria, fungal elements, and viruses in the hindgut that all work together to maintain appropriate physiology, help us, our horses, digest their nutrients and us, and ultimately lead to improved nutrient utilization, feed efficiency, generalized health, and mentation, as well as formed manure. So we want a stable microbiome that helps the colon regulate that water effectively by fermenting the fiber that we're feeding them well and producing the metabolites that our body needs to function. So stable microbes will equate to better water control. And there's a lot of things that can disrupt that, stress, diet, and inflammation being among them. So diarrhea, this is different than free fecal water syndrome. Diarrhea is a shift from having formed fecal balls at all. So we'll get to it, but free fecal water syndrome is formed fecal balls with intermittent water component, whether that means formed fecal balls passing with water simultaneously or it being an intermittent change in consistency of the manure through the day. Diarrhea is a persistent change in manure quality. And so that can range anywhere from cow pie, or we might call like soft formed is typically not diarrhea, but cow pie, like beef cow pie, to profuse liquid feces. It can often lead to systemic inflammation and illness. So you might see a fever and a poor appetite in horses with diarrhea. And occasionally there'll be changes on blood work. Not always, and not always in the early stages, but typically we see changes that can help us determine what could be causing the diarrhea, and then as well as how we're going to address it or how serious it is. This is a little slow tonight, isn't it? So the causes of diarrhea, we usually break them down to infectious and non-infectious causes, and then there's dietary causes fall into the non-infectious causes. Infectious causes, these are the things that you hear about the most and are most concerned about. You might see things like colitis X on a Google search. I will caution you that if you're ever talking to a vet and your vet says that it's colitis, don't freak out. Don't go Google, because colitis X will be what comes up and you think like instantly your horse is going to die, but there's a wide range of colitis causes and outcomes. Bacterial causes would be salmonella. That's the one we are concerned with the most. Viral, like equine coronavirus, very different than human COVID, but same name and same family of viruses. Non-infectious causes, so dysbiosis, whether that's an alteration in our fecal microbiome or hindgut microbiome, and that can be associated with shifts in diet. It can be associated with stress or inflammation due to some underlying disease process, or it may be the result of some therapeutic intervention that you're providing. So whether that is a supplement that is disrupting your hindgut, or like antibiotics are a big one that we talk about in both human and veterinary medicine. Then you can have inflammatory disease, again, a number of causes, or toxins and feed contamination. But true diarrhea, rather than fecal water syndrome, is typically a significant insult leading to systemic symptoms. So again, we kind of went through this, but free fecal water syndrome from a vet perspective, as Aaron mentioned, unfortunately, oftentimes your vets are going to be like, what's the big deal? So your horse has some water occasionally, but is otherwise having formed manure. And so that can be very frustrating for you guys. It's frustrating from your vet's perspective because they can't fix it easily with directed therapies. But it's just a difference in functionality and physiology in your horse that we have to sort out. So again, always has some formed manure component with water. So that might be water at the same time. It might be you hop on the trailer and go to the show and your horse has diarrhea in the trailer, but then is fine the rest of the day. We call that stress diarrhea. But they typically have a normal appetite, normal behavior, aside from signs of stress, and then normal body condition, no fevers or systemic signs, and again, always formed manure present. So tests in free fecal water syndrome are typically normal. Your vet might go through and do all of the routine testing to rule out some of the more serious conditions that occur with colitis or true diarrhea, especially salmonella, because we can have chronic salmonellosis in horses where the horses aren't sick, but they do have salmonella present in higher numbers than the normal functioning GI tract. And so they might do salmonella cultures to rule that out, or other symptoms, CBC chemistries, occasionally, obviously, fecal egg counts to check for parasites, but these things all turn out normal. There's no obvious sign of inflammation and no obvious sign of infection in these cases. So again, frustrates you because we've ruled everything out. The vets can't fix it easily, which really frustrates vets if they can't find a way to fix something. And then you end up having to go to a trial and error approach. And that is, again, because this is a result of some functionality disruption and you can't determine quite what it is. Is it dysbiosis? Is it a inflammation of the gut lining, or some other issue, something dietary that the horse doesn't like, or is allergic to? We don't really recognize true allergic bowel disease in horses, but that is a possibility. Some horses just always get it on peanut hay, which is a legume, and but are fine on grass hays. So it sits in a gray zone between disease and dysfunction, and so we have to change management practices in order to try to see if we can figure out how to prevent the issue or fix the problem from your perspective as the owner. So when to call the vet urgently. So diarrhea or colitis, like true diarrhea, can significantly impact a horse. They hold a lot of water in their hindgut. And so if they start to lose that water quickly, they're going to get into a state of systemic shock. So where their blood pressure drops, and then depending on the cause, they can get very toxic or systemic inflammation beyond what their body can control. So that can sometimes require emergent veterinary care versus urgent veterinary care. I will say if your horse develops profuse liquid diarrhea, like you have a lot of liquid coming through, whether there's fiber components in that or not, that's an emergency. Call your vet in the middle of the night. If your horse is colicky along with the diarrhea, I would call your veterinarian. If it's cow pie manure, your horse is still eating, then that might be an urgent call to your vet the next day. Now, some chronic diarrheas can end up leading to weight loss. And again, that's because of their GI tract is not functioning, so they're not absorbing those nutrients appropriately. And so over time, the chronic diarrheas, it might be chronic cow pies, will result in weight loss. But fever, colic, profuse liquid diarrhea, call your veterinarian because they can get dehydrated very rapidly, and horses require significant volumes of IV fluids to correct that dehydration. So it's very normal for us to give 20 liters at a time to horses when they're having colitis. So when to call the nutritionist. We're working on the vets on how to, help manage this fecal water syndrome, but you're going to call the nutritionist and get some additional input when you've tried everything your vet has run out of ideas, and it's time to move on to something else. Dr. Thunes will go through how we kind of approach this from a nutritional and management standpoint in order to address the functional disruption in the hindgut. And we will say from the start, this is a process. So it is a matter of trying different approaches through over time and over a period of time. So keeping records of what you're trying and unfortunately, having some patience because we'll often tell you to give it 2 to 3 months, any protocol that we try to see if we can get things corrected. With that, I'll pass it off to Dr. Claire.
Thanks, Tiffany. That was great information, and some of which I'm going to reiterate. I thought we'd start off looking at fiber type because I think when people think fiber, they think hay. And when they think carbohydrates, they think starch. And that's not necessarily, fiber is actually a carbohydrate, right? We have to remember that. And so there are many kinds of carbohydrates, right? Lots of different types of carbohydrates, some of which happen to be fibers, and some of which happen to be starches and sugars. And they all play an important role in the horse's diet overall. But when we think about fiber, we've been talking about the horse's hindgut, and that is the source of fiber digestion. And I think, just as a little aside, a useless fact, dinner party fact, is that all herbivores have a part of their digestive tract that is dedicated to the microbial fermentation of fiber. And that's kind of what makes them special as herbivores. Like, we don't really have that ability, right? We do have a large colon, and there are microbes in our large colon, and we are learning that actually those are more important than we've perhaps given them credit for in the past. But in the context of looking at different digestive tract anatomies, our colon is tiny and has a pretty small microbial population, whereas herbivores have massive microbial populations, right? So in the horse, you're going to find their microbial population in what we call the hind gut, right? The back of the part of the digestive tract that's at the back of the digestive tract, that cecum and colon that Erin talked about earlier. If we're looking at cows, then they have a rumen. That's the first part of their digestive tract. That's where their microbial fermentation vat is. Same for sheep and other ruminants. Then you've got things like rabbits, right, which have very large cecums. And so all of these herbivores have a part of their digestive tract that is dedicated to microbial fermentation. And that, in part, is because they have evolved over many, many thousands of years, maybe millions of years, consuming low nutritional value forages that are made up of large amounts of fiber. And mammals do not have the enzyme necessary to break those fibers apart, right? So we don't, as a mammal, neither you, your horse, your cat, your dog, your cow, do not have the enzyme being secreted into your digestive tract that can break apart the complex structures that make fiber carbohydrates what they are. However, the microbial population in your horse's hindgut or in other areas of other herbivores' digestive tracts do. And so we have this symbiotic relationship, right, going on in the horse's digestive tract where the bacteria have this enzyme necessary and they break apart the structural carbohydrates that are in your horse's diet, and your horse is then living on the byproducts of that microbial fermentation. So really, when we're feeding the horse, we're actually feeding the bugs in the horse's hindgut. And if we can keep those bugs happy, we typically have a happier, healthier horse. And so, why have I gone off on this tangent? Well, it's because if you understand that and can kind of keep that in mind, we start to think of, fiber a little differently, right? And we start to understand carbohydrates a little differently. And one of my pet peeves is when people say to me, "Oh, I've been told I need to put my horse on a no-carb diet." And I'm like, great, let's kill your horse, because fiber is actually a carbohydrate, right? So we have to have fiber. Your horse has to have fiber in its diet, right? It is the that is it's the major component of the horse's diet, but not all fiber is the same. Right? Not all of those carbohydrates that make up what we call fiber, in inverted commas. You can see me making my air quotes if you're looking at the video. Not all carbohydrates that make up that fiber are the same. And so there's several different carbohydrates that make up fiber. And so we have soluble fibers and insoluble fibers. And as the name would suggest, right, a soluble fiber is soluble in water. So that would be something like pectin. If you like making jams and jellies, you might be familiar with pectin, right? And so pectin is a soluble fiber. In grass, in pasture, it's about 2 to 4% pectin in grass. Something like beet pulp has like 30% pectin, right? It's really, really high in pectin and soluble fiber. So it's all fiber, but it's different plants, different sources of forage. If we use the term forage, right, which is a collective term we use to kind of lump all of these different sources of fiber into, right? So forage could be grass pasture, it could be hay, it could be beet pulp, it could be soybean hulls, right? Those we all call, they're all forages, they're all sources of fiber. And so we have our soluble fiber, we have insoluble fiber. And when we look at the insoluble fiber, we're looking at now things start getting more complex. Now we really need our microbes because our insoluble fibers really require microbial fermentation. So these are things like cellulose, which is fermentable by the microbes. Then we have lignin, that's like tree bark, right? Not even the microbes in your horse's bug can bacteria can digest that. And so all of these are different types of fibers. So when you're thinking about the forages in your horse's diet, what I really the takeaway from this slide is that they're all providing different sources of fiber, right? Different types of fiber to those microbial population in the hindgut. And so variety of fiber is really important to that bacterial population. And the more types of fiber we can provide our horse, the more diverse the fiber, the more diverse the microbial population, because the microbial population in your horse's hindgut is somewhat specific to the types of fiber you're feeding, right? And we'll get to that in a minute, which is why I think it was Dr. Tiffany said, making changes to diet slowly over time is so important because our microbial population in the hindgut is specific to the different types of fibers and carbohydrates that you're feeding. So if you suddenly go, oh, today I'm done feeding this type of hay, I'm going to randomly change to this kind of hay, they're suddenly like, whoa, hang on a minute. The chemical composition of that diet has completely changed, and they have to shift and adjust to adapt to that. And so if you're looking at fiber, variety of fiber, as I mentioned, is important. The quality of the fiber is important, right? The quality, the sources of the fiber that you're feeding. And then we get to particle size, right? So particle size, I think we might have already mentioned a little bit before, but particle size, you might have long stem fiber in the form of hay. That's obviously a very large particle size. You might be feeding pellets, which is hay that's been ground, and the particle sizes in that is going to be millimeters, right? And it's been compressed into a pellet. And when that horse chews that pellet, it crumbles and falls apart, and you have huge amounts of like very, very tiny particle sizes, which is actually easier for the horse to digest because it has a greater surface area. And it's also a little easier on the horse's gut lining because it's going to be less abrasive than that longer stem forage that you're feeding. So I think it was Dr. Erin who mentioned at the beginning that sometimes we have irritation going on from that mechanical irritation in the horse's large colon. In part, if we're feeding very stemmy hay, that can sometimes cause irritation in the gut lining and inflammation. And so sometimes what we'll do is we'll actually take away some of that stemmy hay and replace it with a smaller particle size, something like a hay pellet, to remove some of that mechanical irritation that's going on in the horse's hindgut. And obviously we need to make sure we're feeding adequate quantity, right? Because as I mentioned before, horses evolved eating forages. 60% of their digestive tract volume is dedicated to the microbial fermentation of forage. So we really have to make sure that we're feeding at least 1.5%, ideally more than that, of their body weight per day as some sort of forage. So feeding patterns and routine are really important, right? And so our modern day horse management is very much based on meal feeding. And so that horse that evolved on the plains of North America eating low nutritional quality forages had to eat for 16, 18 plus hours a day because the quality of the forage was low and it wasn't particularly digestible. So it had to eat a lot of forage. And so it was eating all the time. And then we came along and domesticated them. And thank goodness we did, because I love getting to hang out with my horse, right? And so I love that we did domesticate them. But we then decided that, we domesticated them initially to do work in fields and plow fields and do, jobs like that. And so they were out all day from sun up to sundown. And so they only got fed twice a day, and we eat meals. So why not, right? But unfortunately, that's not how their digestive tract evolved. And so we now have management structures that are very much based on feeding a couple of meals of hay a day, which is not how they're designed to eat, right? So long gaps without forage can really disrupt that hindgut microbial population. Also, when we first started, we domesticated horses and put them to work, they couldn't actually make, because they couldn't eat for 16, 18 hours a day, and we were working them quite hard. They were, out all day walking around, pulling carts and things. They couldn't maintain their body weight just eating forage. So now we had to find something that was more calorie dense. Well, what did you have on your ranch? Back then, corn, oats, and barley, right? Whatever you were growing on your farm. So that became our source of additional calories, as we lent really heavily on high starch, and because of what was easily available. So our model of horse feeding was infrequent meals, more starch, and you can start to see how we've gotten away from how they actually eat in their natural setting. And then also we do, sudden dietary swaps. And you might not think you ever swap your horse's diet. You might think, gosh, I fed my horse Timothy hay and whoever's ration balanced over the last 5 years. Okay. But every time you get a new batch of Timothy hay, that's a diet swap. And so just because you're feeding Timothy, the Timothy you're feeding today is not chemically identical to the Timothy you were feeding last week. So you have inadvertently changed the nutritional composition of your diet, even though you're looking at it going, well, it's Timothy, right? But it's not all Timothy is the same. So those fiber components, the carbohydrate fractions that are in that Timothy hay are different in every load of Timothy hay that you feed. So every time you buy a new batch, you're making a sudden dietary swap if you don't carefully mix your new Timothy in with your old Timothy. And let's be honest, very few of us have the luxury of being able to do that, especially if you're in a boarding facility. And seasonal pasture shifts, maybe those are more obvious. I think we're all pretty aware that sometimes our pastures die in the winter if you're in a cold climate. And then right now, the grass is starting to come back in. And so suddenly your horse has gone from having no pasture grass to maybe having a lot of pasture grass. Or maybe you're in a boarding situation where your horses are in a stall all winter because they're not allowed out in the winter because they would tear up the pasture because the ground's too wet. And then all of a sudden they're put back on pasture. All of these things cause shifts and changes in microbial population in your horse's diet, can upset that microbial population, cause stress to the gut lining, cause irritation to the gut lining, and could lead to free fecal water syndrome. So I mentioned just then stress and gut function. Your gut, your GI tract, and your horse's GI tract are the largest components of your immune system, and they are extremely sensitive to stress. And I think that if we just think in ourselves, if you were sitting in a waiting room, you had, let's say you'd had a medical procedure done and you were waiting for the results of that medical procedure, and you were sitting in that waiting room waiting to go see the doctor for them to tell you whether or not, what they had found in the tests you had done were going to require surgery or not. I suspect you'd be sitting in that waiting room and your stomach would be in knots. You would feel tense in your gut. Your hands might be slightly sweaty, right? You might be aware that you're stressed, but you would feel it in your GI tract. You would feel that stress in your gut. And so horses feel stress in their gut too, right? When we take them to shows, when we put them in the trailer and take them to the vet, when the farrier comes, when the vet comes to you, like all of these things can be stressful events to your horse, and they have impacts in your horse's gut. In fact, we know that when you put a horse in a horse trailer and trailer it, that can immediately impact the diversity of the bacterial population in your horse's hindgut, and it can stay disrupted for up to a week. So we know that stress is having a direct impact on that microbial population. And so it can be something as, something that we do every day with our horses, right? Transporting our horses, a change in the weather, right? Herd changes. We may not think about that very often, but maybe a new horse comes in and gets put in the pasture, right? That is stressful. These are flight animals with very specific social dynamics. And, when we change that, that's extremely stressful to them. So, stress absolutely can, I think we all know that when we have an impaction colic, we hope that we put the horse on the trailer, right? And that we get a stress poop out of them. And hopefully that colic situation resolves itself, right? So we know that stress can have an effect on the digestive tract. You'll see horses with very healthy, normal manure get on a trailer, and their manure becomes loose because they're stressed. So we know that the nervous system has a it's very sensitive to stress, and it affects the GI tract. And it's not always, stress doesn't always look behavioral. In fact, horses can look perfectly calm and normal and behaving perfectly fine, and they'll just be internalizing all their stress, right? And that's why some of these horses, why our veterinarians are throwing their hands up in the air, because all the clinical symptoms are completely normal, except for the fact that they have free fecal water syndrome, right? So, it doesn't always look behavioral, and it doesn't always look like there's something radically wrong, but we know that there is stress in that GI tract. Something is not functioning as it should be. Mycotoxins, I kind of love mycotoxins because I feel like they're something that people just don't think about very often at all. They're like, it's like the best kept secrets of gut disruption, I think, in horses. People who raise cattle are far more aware of mycotoxins than people who have horses. And that's partly because cattle are much more obviously sensitive to mycotoxins than horses are. The symptoms that we see with in horses for mycotoxins are a little less obvious and could be something else, and so it's not what kind of comes to mind when we think digestive distress in a horse. But these are basically molds, and there are several different types. Some of the most common that we see is something called fusarium, right? And so these tend to disrupt normal cell function, and they affect the cells located in the small intestine as well as other areas of the digestive tract. And the clinical effect can be reduced feed intake, reduced growth, less, horses that lose body weight. So they're definitely, having an effect on your gut lining. And horses seem to be quite sensitive to, these mycotoxins, but they're, not, it's subtle, right? And it's really easy to write off and think that it's something else. So again, like some of the signs that horses are suffering from mycotoxin ingestion might be like general lethargy, unexplained poor performance, refused feed intake, inconsistent manure, right? So free fecal water syndrome definitely fits that bill. And you might think, well, I feed very clean forages. There's no mycotoxins in my hay or my pasture. But I was just having a conversation recently with a veterinarian who is a leading expert in equine asthma. And in some of his work, he has had clients with different hays, and they brought their hay in. And he actually did a study himself where they grew hay, and he asked the folks growing the hay to bale some of the hay 2 days earlier than it should have been. So it was baled much more moist, right? So it was bound to mold, which it did. And then he did mycotoxin testing on both the hay that was baled at optimal conditions and the one that was baled too damp. And certainly the one that was baled too damp had far more mycotoxins, but the one that was baled under perfect conditions also had significant levels of mycotoxin, right? So even if your hay looks very clean, there are going to be molds and bacteria in that hay that could have, an effect on your horse. And I think it's important to remember that all horses are individuals, and it's not uncommon to have a boarding facility or where you own yourself several horses and only one of them has free fecal water syndrome, right? So it may be that your horse just has a genetic, propensity to suffer from free fecal water syndrome. It's more sensitive to these things than the other horses in your care or that are kept in a similar situation. And that can make it tricky because you sort of think, well, it can't be the environment or whatever because none of the other horses are affected, but you have to remember that they're all individuals. So when we talk about functional nutrition for, free fecal water syndrome, there are several things that I look for in products that I'm going to use on these horses. And the first one are pre and postbiotics. I'm not a huge probiotic fan. I'm not convinced that all probiotics get to the hindgut alive. A probiotic is a live bacteria and it has to get to the hindgut and actually still be alive in order to reproduce and be effective. But prebiotics are sources of, think of them as like the food that the bacteria already in the digestive tract like to eat in order to reproduce and be healthy, right? So when we give prebiotics, we're helping support the already existing healthy bacteria in the gut. Postbiotics are the byproducts of sort of microbial fermentation and all the good stuff that's inside of those bacteria. So sometimes, or yeasts as well. So postbiotics tend to be from yeasts and beneficial bacteria. And they're the fermentation end products and the metabolites from within those bacteria and yeasts that help boost the immune system. They've been shown to help reduce, negative digestive symptoms such as diarrhea. And they also reduce inflammation and improve the strength and integrity of the gut lining. So I particularly like them for horses with free fecal water syndrome. Glutamate is an amino acid. So when we're talking about amino acids for the digestive tract, glutamate is a big one. It's necessary for the repair of the gut lining. And so you'll commonly see that in good, products that support gut health. It helps with tissue repair. It helps with regeneration of intestinal tissue. So it's going to help any damaged gut lining rebuild itself. Similarly, zinc is really important for wound healing and cell division. So making sure that your horses have adequate zinc in their diet and that the diet is properly balanced to meet their trace mineral needs is really important. And then butyrate's what we call a volatile fatty acid. So, well, butyric acid as it's here on this slide, but butyrate and butyric acid are the byproducts of microbial fermentation. So I mentioned earlier that those bacteria in your horse's hindgut are fermenting and breaking down that structural carbohydrate and fiber, and that the horse is living on the byproducts of that. And the byproducts of that are volatile fatty acids, one of which is butyrate. And butyrate is a primary energy source for the cells that line the colon. And so butyrate is really important for maintaining gut integrity. It helps to sort of regulate the microbial population. It promotes a healthy gastrointestinal tract environment. And so by giving butyrate, you're actually providing that compound all the way down the horse's digestive tract. So these are some of the things that I look for in products that help support gastrointestinal health, especially in horses that have free fecal water syndrome. So management foundations for gut stability, obviously forage first, right? Whenever, I don't care if you're feeding a mini donkey or an Olympic champion, they all require forage first. The foundation of every diet is forage, right? So that has to be the foundation of your diet. But just think about the fact that forage doesn't always have to be in the form we traditionally think, right? So traditionally we think pasture and long stem hay. Some of these horses are going to need to have their forage in a different form, for example, in pellets, right? To help reduce some of the stress on the digestive tract lining. Hopefully that would just be, a small amount, maybe 25% of their forage intake as pellets. Some of them are going to need to have all their diet as pellets for some period of time, even if not forever. Consistency is really important, right? So not yo-yoing between ideas, and it's really tempting. But as you heard Dr. Tiffany say earlier, you need to give things, a couple of months to take effect when you're making changes. And oftentimes owners get desperate and make a change and they don't see a difference in a couple of weeks, and so they change something else. And so you really have to kind of stay the course. And if you are going to change something, just change one thing at a time so that you know whether or not the thing you changed actually did anything or not, right? So make those changes slow and intentional, and try to not get carried away and do multiple things, like do unnecessary interventions, and really think about the big picture impact of some of the interventions that you might be considering. So I think it was Dr. Tiffany who mentioned it's really important with these horses to kind of spend some time, get out a journal, write down what you notice as triggers for this. Because what happens with a lot of these horses is sometimes it just sporadically resolves and goes away on its own, right? So sometimes free fecal water syndrome just like disappears. And then a month later it comes back. And you're like, I don't understand why. And there may not be any rhyme or reason to why, but try to note everything that you notice, right? What did the weather do? Did you change their work level? Did you take them somewhere in the trailer? Did a new horse come on the property? Did the farrier come? Like, write down everything, even if it seems completely irrelevant, right? Write it down. And because what you may start to notice that there are patterns that the free fecal water syndrome comes about, when the weather changes, or when after a show or something. I know a horse that has free fecal water syndrome that's kind of associated with his equine asthma. And so when he is going through an asthma flare and his level of systemic inflammation goes up because of his asthma flare, you can guarantee that almost, 2 days later, he's going to have free fecal water syndrome. And so when he has an asthma flare, we can then immediately take a step to do things to support his digestive tract in the hopes that he doesn't end up with free fecal water syndrome. So improvement is often gradual. And as I said, sometimes it resolves for no rhyme or reason. Sometimes it just takes a lot of methodical trial and error. And what works for one horse doesn't work for another horse. But there are, as I mentioned, some ingredients that really do seem to help more horses than not. And I think that I am now passing the baton back to Erin.
Yay! Thank you, Dr. Claire. That was a lot of very helpful information. I just want to jump in real quickly, pop quiz everybody. If you can jump in the Q&A or the chat and tell us one thing you have learned so far, that you will be graded on this, and I will send you a report card immediately after. I will also give you, Dr. Claire almost got to it, my favorite party information that I like to give out. And you can imagine when you hear this, how cool I am at parties. The two animals that have the most similar GI tracts are the rabbit and the horse. What's interesting about that is that those are both really good jumping animals. So does having a large cecum make you a good jumper? I don't know. Research is out there. Anybody wants to fund it, I'm game. But food for thought. If you ever want to go to a cocktail party with me, that's the sort of vibe that I bring. Really fun. I'm sure people are lining up at the door to chat about cecums. Also, if you ever feel like you're not riding a horse, you're riding a bunny rabbit, that is why. I have several bunny rabbits in my farm at home. And when I learned that a horse is really just a 1,200-pound bunny rabbit, it made a lot of sense to me in the way that they behave. So Dr. Tiffany and Dr. Claire gave us some really great information about things that we can do for diet and management. One of the things I always do, and I can't do it in a webinar, but when I speak in person, I generally ask people how many of them have an equine veterinarian, and I usually get close to 100% hand raising. And then when I ask how many people have an equine nutritionist, the number drops significantly. I will say nutrition is incredibly important to your horse. It is the most important part of your horse's life is their diet. And as a veterinarian, I can say very clearly that we do not get a lot of nutrition education in vet school. I have had to do a lot of self-teaching on nutrition. I've had to make friends with the very cool nutritionists. They let me in their club sometimes if I'm really, really nice and bring coffee. But if you do not have an equine nutritionist in your life, particularly if you're struggling with manure issues or any health issues whatsoever, I would strongly recommend going out and finding yourself one. If you're really nice to Dr. Claire, she might take you on as a client, but there are a number of other equine nutritionists around that can really help with some of these problems.
Dr. Erin, can I just jump in and say one thing about Poseidon? We actually have a full-time PhD equine nutritionist, Dr. Chris Mortensen, and he is just absolutely fabulous. I also want to add, we have to be so careful where we get our information from, because with social media and all the Facebook forums, there is so much incorrect information that's given out there, and who suffers from that incorrect advice might be really well-intentioned. It's our horses. So make sure you are getting advice from people who are actually qualified and experienced to deliver it. And just before I head over to you, loving all these comments coming through. I'm actually noticing mycotoxins is showing up a lot, which is really exciting because we'll talk about mycotoxins again later on. So thank you for keep sharing these things. I think everyone's going to be graded quite well. They've done well.
So far the grades are very high. So keep going, guys. I'm excited. So we've talked a little bit about what we can do with our veterinarian, what we can do with diet and management. Unfortunately, we see a lot of horses where diet and management changes don't solve the problem, or we actually aren't able to make the diet and management changes that Dr. Claire has recommended. There are a lot of places where pasture isn't available, or it's impossible to get the horse off pasture. Types of hay can be very limited, what the horse will eat, what their job is. There are a lot of reasons that restrict us from being able to do certain strategies. And that's where we're going to have to go beyond just diet and management. And that's where supplements come in. So we do what we call our ultimate 90-day gut reset. And when we do that at Poseidon, we always start with the horse's diet. So this is a little bit what Dr. Clair talked about. Obviously, fiber first. We want to check our horse's diet. There are some software programs online that you can put your horse's diet in. You can also make sure that you get yourself a qualified equine nutritionist, someone that is well educated in equine nutrition. And I really like to see some formal and professional education in equine nutritionists. Those people are all over the country. You can see them in person. They also do their work really well digitally. That's great. We want to talk about diversity of fiber. Dr. Clair talked about that a little bit. One of the big questions I get is we had that word variety and we had the word consistency on the same slide. And that can be a little bit confusing because in theory, those words are opposite. We want to have a variety of fiber for our microbiomes, but we want to keep that variety consistent. That doesn't mean alfalfa on Monday, Timothy on Tuesday, orchard on Wednesday, and beet pulp on Thursday. And it absolutely doesn't mean a bran mash every Sunday. Doesn't mean a bran mash ever, just if you want to know, but definitely not just on Sunday. So we really want that variety to be consistent across the horse's daily intake so that those microbes are getting consistent food sources. Remember, we are really just feeding a big vat full of microbes. That's who we're actually feeding. It looks like it's the horse, but it's really those bacteria that both Dr. Tiffany and Dr. Clair mentioned. We are feeding those guys. So we want to make sure they have the food that they like, but we also want to make sure that they have the environment that they like. And as Dr. Clair mentioned, those guys really don't like stress. We always have to remember whatever we're doing with horses that they are prey animals. Their system is designed to flee from a threat. Their stress is short and sharp. That's what they were evolved to deal with. It is about running away from the lion, and you either make it or you don't. And anyone who's been knowing my talks, we know about this. We all have 10 minutes of stress. Maybe one of us gets eaten. That might be Linda this time. Linda's not stressed anymore. She got eaten. The rest of us aren't stressed anymore. We didn't get eaten. The stress is over. Our modern day horses experience hours of stress, days of stress, weeks of stress. Their system is not designed to cope with that, and their bacteria are not designed to cope with that. So when we come in and we look at a horse that is having manure issues or is having free fecal water syndrome, we want to look at the diet, but then we also want to look at what stress is in this horse's life. We definitely have those horses where we can identify a single trigger. It's a weather change. It's when the farrier comes. It's when we get a new batch of hay. That's manageable. And then we have other horses where the stress is maybe more subtle. It's that we moved from a place that we had pasture to a place that we didn't, or we changed seasons and we started to introduce more hay as the grass died down. Or maybe we've developed an accumulation of sand, or we've developed an accumulation of parasites. Those are things Dr. Tiffany talked about. Or maybe we have a mycotoxin load that is slowly building up because those mycotoxins are present in pasture, they're present in hay, they're present in feed. Even as Dr. Clair mentioned, the best quality hay and the best quality feed still can contain mycotoxins. And over time, that actually causes what we call a toxicosis in the horse. And they are overwhelmed by those toxins and they can cause a myriad of health issues. So we're looking at the diet. We are trying to reduce stress where we can. And then sometimes we really have to go beyond diet and management. And that's where we're going to look at supplemental support. And for me, supplemental support works best when it targets function, not symptoms. I don't know if everybody knows this, but horses actually make their own biotin. So supplementing biotin for a horse with bad feet is actually targeting a symptom, not targeting function. If we work to improve the horse's microbiome, that vat of bacteria, they will produce their own biotin and they will grow beautiful feet. So that's what I mean when I'm talking about, are we addressing function of the GI tract or function of physiology, or are we addressing symptoms related to a problem? And we always find it's more effective to target function. So we want to help those microbes. That's our goal. And we want to improve their environment. We want our microbes to be well fed. We also want them to be happy. Our good microbes, our fiber fermenters, they don't like a lot of acid. They like their environment to be more basic. So buffering is really important whenever we're supplementing. And that's, a lot of people are familiar with that in the stomach, but the hindgut also loves buffering because, again, those bacteria don't like an acidic environment. We also want to do everything we can to protect and repair the gut lining. We spoke at the beginning about how important that gut lining is in actually controlling water balance and providing kind of that nice, cozy home for our microbes to live in. So if they're not getting food, and they're not in a comfortable home, they're not going to be happy and they're not going to work for the horse in the way that they should. That's the deal. The horse provides a nice, comfy, cozy home, and the microbes do their work. If the horse stops holding up their end of the bargain, the microbes are not going to hold up their end. So that's what we're always trying to do. And then we always want to protect against environmental toxins, as we discussed, and also be aware of introducing inflammation. I go in a lot of barns. It's a favorite part of my job. Is I love to go in a feed room. Some women like shoe stores. I love a feed room. Nothing better than a feed room. But I go in some of these feed rooms and I see 4, 5, 6, 8, 10, 12 supplements. And each of those supplements might have 1 or 2 active ingredients. And the rest are all fillers, sugar, starch, byproducts. Whenever you're introducing that into your horse's system, you're introducing inflammation because you are giving them stuff to digest that they're not designed to process. That taxes the system. It taxes the microbes. So you might be delivering something good, but it's swimming in so much bad stuff that it's not actually doing what it's supposed to do. It's a little bit like candied Brussels sprouts, sort of defeats some of the goodness of the Brussels sprout. So we want to deliver healthy, functional ingredients, but without anything that's actually hard for the horse to digest. So our third step, we've done diet, we've done management, we've done everything we can do there. And then we combine our 2 hero products, which we're going to get into a little bit more detail, our digestive HP and our stress paste. So what's really important about the gut lining is it actually renews pretty quickly, every 2 to 3 weeks. And the gut microbes respond really rapidly to diet, stress, and environment. That's what Dr. Tiffany was talking about, is that any kind of quick change is going to cause a huge cascade effect in our microbes. So we always talk about giving 90 days when we do changes, because yes, the microbes are going to renew quickly, but we need to do that for a while so that we keep it really consistent for them and give them a chance to really embrace this new change. I want to mention too, while we're here, we had a lot of questions come through about fecal transformation, and that's a learning for me because I didn't put a slide on fecal transformation in the talk. We've had so many questions come through. I think it's important that we hit on it. So transformation is a really fancy word for getting your horse to eat another horse's poop. And this happens across all species. We give cows in particular, they actually do it in humans. So the theory is that if we can take a horse's manure that is really healthy, that should tell us that horse has a very healthy microbial population. And if we feed that manure to, actually don't feed it, we pass it into their stomach, but if we put it into a horse that doesn't have a very good microbial population, we might be able to transfer those healthy microbes from our healthy horse into our unhealthy horse. This is certainly a strategy that can be effective. It's a little bit hit or miss, and if it is effective, it tends to only be transient. So while it's certainly something to consider and it can be helpful, particularly in acute situations or really dire situations where the horse is really unwell, it isn't going to be a long-term fix. Your horse isn't going to get a fecal transformation and then be perfectly better unless we're also addressing other things. So it's definitely something to think about. It's something to talk about, but I don't want people to think that that's a one-off fix that's going to change everything. Because all we're doing is introducing some healthy microbes for a period of time, but we have a really hard time getting those guys to actually live and repopulate. We are much better off to try to improve the microbes that we already have in the horse. And again, that's through diet, reduction in stress management, and then introducing functional assistance through supplementation when needed. Keep wanting to use the computer to change the slides, and that doesn't work, and you'd think I'd figure that out. So stress paste is a product I like to start with in this discussion, in the free fecal water discussion, because stress paste is going to be your fast acting, quick product that is going to get in there and really improve things in a hurry. What's great about stress paste is that it contains all natural ingredients that are designed to address the physiology of the horse when they're stressed. So everything about the horse's body that is affected by stress paste is going to jump in and support it. Some really cool ingredients. Dr. Clair mentioned pectin, which does a great job stomach coating, but it's also a great water soluble form of fiber for the cells, and the whole horse's body loves pectin. We've also got B vitamins in there, and B vitamins support the horse's natural eating and drinking behavior. And whenever we've got manure issues, particularly diarrhea, we want to make sure our horses are eating and drinking well. It's got great stomach buffering and hindgut buffering. So we're going to support the pH for the horse's whole body. We know that's important in the stomach, and hopefully we all just learned extra bonus points for anyone who puts in the answer to their quiz that they learned that buffering is important for the hind gut, because I taught you that. So obviously it's more important, but we're going to make the environment really happy for those microbes. We want them to have a happy home. We want them to have the food that they like so that they are happy and they do the job we need them to do, of fermenting fiber for our horses. And then we've got those amino acids that we know are integral to building muscle, but they're also integral to building the GI tract throughout the course of your horse's entire body. So that applies to the stomach, that applies to the small intestine, that applies to the hind gut. Anywhere that we need to repair and heal that GI tract lining and we need to produce mucus, that's what our amino acids are going to do. Actually, there's a lot of talk right now about the amino acids L-theanine, which is currently banned for USEF and is not allowed in competition. But there is an amino acid called L-threonine, and L-threonine is actually the most important amino acid to mucus production. We have that in our products, and it is really important for horses maintaining GI health, that they be able to produce enough mucus. That protects the whole lining everywhere from insult, whether that's from acid insult or that's the hay insult that Dr. Clair was talking about. So stress paste is a great thing to have in the feed room, great thing to have in your tack room, great thing to have in your trailer, particularly horses where we're in that acute free fecal water. If somebody calls me and their horse for the very first time is having fecal water today, stress paste is going to come in and it normally fixes it within 12 to 24 hours. My clients that have free fecal water with defined triggers, I have a pony that I deal with, and he does not like storms. I don't know if it's pony doesn't like storms or the pony's bacteria doesn't like storms, but if we are getting a storm here in Florida, if we are getting a hurricane, if the barometric pressure drops, that pony blows with free fecal water syndrome. He might be completely normal. And then like people say that their joints are sore when we're going to get rain, if the barometric pressure drops, this pony is getting free fecal water syndrome. And so his owner has learned to monitor the weather. A couple of days before that barometric pressure is going to change, she uses stress paste on him, and that prevents him from going down that road. It's also fantastic if you've identified, look, whenever we get a change in hay, whenever we are moving barns, or when we're getting into that winter period, if we know that there are things that set our horses off, we've been keeping our journal, like Dr. Clair said, the stress paste does a fantastic job of actually stepping in and helping horses cope with that situation. When we do our 90-day gut reset, I like to start with 3 to 5 days of the stress paste at the same time as we use our digestive HP. And I'll go through that in detail when we get into our case studies. But digestive HP is our daily feed through products. That's a complete feed through. It does the stomach, the small intestine, and the hind gut. It does take a little slower to take effect in the horse. So that's why I like to start with the stress paste at the beginning, because you're going to see real improvements right away with the stress paste. And then the HP is going to come along and it's going to slowly improve the health of the entire GI tract, and particularly that hind gut. When we're talking about manure issues and we're talking about free fecal water syndrome, we really want to look for ingredients that are going to target the hind gut. Our buffers are obviously really important there. We've spoken about that. Our pre and postbiotics, Dr. Clair spoke about that. Postbiotics are the most efficient way to improve microbial health. And so we lean on postbiotics in both of our products, but the HP in particular contains enough research-proven postbiotics to improve microbial health, and that is really important. Our amino acids again, and then a mycotoxin binder. And that is different from any other product I've ever seen that exists on the market, is that we have a discriminate mycotoxin binder. So it selectively binds and remove mycotoxins throughout the GI tract, and only mycotoxins. I've seen a number of people come through the chat that have asked about other products that contain bentonite clay or charcoal. Bentonite clay and charcoal are binders, but they bind whatever they meet. There's a very popular product on the market that part of its name has to do with a kitchen cleaning item, and it will actually go through and bind up water. So it will eliminate diarrhea in the short term, but it's not actually solving the problem because it's just binding water. So it's not actually necessarily removing the toxins, and it might bind to other nutrition and it might bind to other medications. So it's really important to use a next generation mycotoxin binder that's actually going to bind to mycotoxins. Another ingredient in HP, which isn't so important necessarily directly to hind gut health, but are digestive enzymes. So as Dr. Clair discussed, horses aren't really designed to process a lot of starch in their diet. And the starch has to be digested and absorbed in the small intestine. If it's not, it will fall to the hind gut and it will lead to an acidic environment in the hind gut. So it will lead to hind gut acidosis. By including digestive enzymes in the digestive HP, we actually allow the horses to process and digest all of their starch in their small intestine, where they can actually absorb it and use it. And so, one, we're getting better calorie conversion from our diet, but we're also preventing that high gut acidosis, which is damaging to the microbes. So that's what I mean by it being a complete feed through. It actually targets all of the organs in the GI tract, none of which function in isolation and all of which need to be working together. So I want to go through how we actually do the 90-day gut reset. And again, this is when we've looked at the diet, we've looked at we've looked at management, we've looked at stress reduction, we're doing everything we can do. We're still not achieving the results that we want. And so we're going to look to supplementation, but we're going to be really careful about choosing supplements that contain only active ingredients, no sugar, no starch, no fillers. And the other comment I want to make about supplements is it's really important that we stay ahead of the research. So there are a number of supplements on the market that were formulated 20, 30, even 40 years ago, and they're not at the cutting edge. What we've done differently is we have only included ingredients that are at the cutting edge of research, are shown to work in the horse and shown to be effective, and we combine those together in a precise way. So the way we do the gut reset, we start with 3 to 5 days of stress paste as you're introducing the HP. Remember, Dr. Tiffany told us we want to make changes slowly. Dr. Clair told us we want to make changes slowly. So even though the HP is going to improve the health of the GI tract, we need to do that slowly. So we typically take about 2 weeks to get up to the full level of HP. Stress paste is going to really help us kick off with a bang. And then the HP over time is going to get there. I typically start to see changes in horses' manure with stress paste in 12 to 24 hours. More chronic horses or horses that have been struggling with this problem for a long time, it can take 30 to 90 days. So as with any change you're making, you need to give it time to work. And I want to set the expectation that 90 days is a good amount of time to go, yes, this is improving, or no, it isn't improving. And I think that's really important to remember. Most of these things we're not fixing overnight. We have to change that microbiome really slowly.
And can I just add, if you are doing the 9-day gut reset and you're feeling that you're not getting the results you want, please reach out to us at Poseidon. That's where our team of vets and equine nutritionists are there to help you, because we have so many fantastic case studies that if you're not getting the results that you're hoping, we want to find out why and work with you on that.
Yeah, absolutely. And if we can't give you the full nutritional support that you need, we can often bring in a nutritionist to help you. We can bring in your veterinarian to help you. We can get everybody involved in the team that we need to get involved in the team. But this is how we use our products. So again, 3 to 5 days of stress paste at the beginning. We're going to introduce the HP slowly. We tend to be able to get rid of almost all of our other supplements once we get that gut functioning the way that it should be functioning. We're going to do a couple of case studies now because those are way more fun. So this first one is Yakka. Yakka was a 20-year-old 17 one-hand Percheron Australian stock horse gelding. So an interesting combination of breeds there, and pretty typical of what I see in the sort of manure issues. An older horse, we know that as horses get older, we lose a lot of that resiliency, robustness, and variety in the microbiome. Unfortunately, everyone loves my lion analogy. Horses were not meant to live this long. Horses were not designed to live into their late teens and 20s. It's fantastic that they can. I personally compete a show jumper who is going to be 21 years old this year, and I am so grateful for his experience and maturity, but we do start to see health effects in our older horses, and they do require more support. So Yakka had ongoing manure issues for several years. This could go from soft feces to diarrhea. They'd tried a number of supplements, a number of diet, a number of management changes. And then Yakka did our 90-day gut reset. And you can see the change in this horse's manure is unbelievable. This is normal formed manure. This is what we want to see. And that was literally from just adding the 90-day gut reset. We didn't change anything else. Everything was working well for him. They tried everything, and we saw huge, huge changes when we actually got him onto our products. And this is so normal for me. I love poo photos. Actually, most of your veterinarians and your nutritionists will love poo photos. This next one is a horse called McCoy, and McCoy is actually a really cool guy. He is a retired police horse, and his owner is actually a retired police officer. And he had always been a normal, healthy horse, but he'd always had cow patty-like manure. I actually met his owner at the equine affair in November in Massachusetts, and this was her only problem with the horse. He's an amazing horse, but his manure is just disgusting. And she started a gut reset, and within 2 weeks, he went from cow patty manure to completely perfect normal form manure. And no one believes me that those two manures are from the same horse and they're 2 weeks apart, but they absolutely are.
Has always given me cow patty-like piles, and I just knew something was off. So when I initially met Dr. Roddy at the Equine Affair, I decided to go ahead and try the reset. Because McCoy, who presents no issues whatsoever, has always given me cow patty-like piles, and I just knew something was off. I wasn't sure exactly what, but listening to Dr. Roddy and what she said about what the HP does, I decided to give it a try. So McCoy's manure was easy to identify in the paddocks every morning. No matter how much was out there, we knew which one came from him. So I picked up the gut reset on November 14th, and we started it the next evening. The stress paste was introduced over 4 days, and the digestive HP was incorporated into his meals twice a day in increments. He still gets it twice a day, and he's eating it just fine. And probably less than 2 weeks into the reset, he immediately had formed manure piles, exactly how they're supposed to look, and it was evident immediately that it was doing something, and obviously what it's supposed to do.
Last case study is a horse called Zeus, and Zeus was having regular manure issues and also free fecal water. He was also a picky eater, which is interesting because I typically don't see appetite issues with our free fecal water horses, but Zeus was a picky eater. So his owner was very keen to try a gut reset, but she was a little bit concerned that he wouldn't actually eat it. And so now here, if you want to play the video from Katie, we can find out how she found her horse response to products.
Hi, my name is Katie, and we live in Wisconsin, and we have 2 draft horses and a mini donkey, and we have our draft horses on digestive HP. We have a 23-year-old North American spotted draft named Secret, and we have a 2.5-year-old Percheron named Zeus. The reason we started on digestive HP is because Secret had a colic episode about a year ago, and we had him on a supplement before, but that supplement was only hind gut, and we wanted whole gut for him. And it's very important for us that we take good care of our boys. They're our 4-legged children, and Zeus, our 2.5-year-old here, he had fecal water syndrome. So we started him in also on digestive HP to be able to help with that. We've definitely seen great manure output. We have definitely seen less fecal water issues with Zeus here, and we're very happy with the product, and they eat it without any issues. So that's the biggest part, right? Especially the one behind me here is curious and also suspicious about what you put in his food, and he eats it right up, and so does the other guy, Secret. So again, we wanted it because it offered whole gut benefits, and that's really important to us, and we're a very happy customer.
I hope that you could at least appreciate what went on with Zeus and how well he improved. And for me, that is really just about supporting the elements of the GI tract that we can't fix any other way. There are a lot of limits to what you can do with your diet. There are a lot of limits to what you can do with your management. And sometimes you will need to bring in additional ingredients. And that's what we're trying to do with our company. And that's what we're trying to do with our supplements.
A question came through quite a few times around free fecal water and Cushing's.
Yep.
Could you just talk to that really briefly?
Yeah, no, I did see that question. So we haven't actually found a direct correlation between free fecal water and Cushing's, but certainly the groups of horses that we have that get free fecal water and the groups of horses that we have that get Cushing's are generally our older horses. And so as I said, maybe a little unkindly, horses weren't meant to live into their late teens and their early 20s. So we know that we see a degradation in our microbiome in our older horses. We know that our older horses don't cope as well with stress. And we also know that our cushingoid horses tend to have higher systemic cortisol levels. Cortisol is the stress hormone, and that is keeping the horse under constant stress. And actually, as we've discussed, our microbes do not like stress and they do not like cortisol. So while I don't believe that free fecal water syndrome and Cushing's are directly linked, I think that those horses tend to be an older population who struggle with their gut health, and they tend to be horses that have a lot of cortisol in their bloodstream, which isn't great for their gut health.
Thank you for that. There's a few people saying they haven't seen the poll. It should be jumping up on your screen. If it's not, Harry, I'm not sure whether you can work some magic back at head office and make sure everyone's getting that. If not, please jump on. If you've got time, send us an email. Let us know what you learnt, what you'd like to know more about. As you can see, we put so much effort into this webinar, and having this incredible technical team available tonight is such an opportunity for all of you. They have done such a great job in trying to answer so many questions during the webinar, but we can't get through to all of them. If you have a burning question that we haven't answered, please send us an email, contact us on Facebook or on Instagram. We have a very active social media. We have a big customer service team. They are real people answering your questions with our vets and nutritionists as well. So if you haven't got your answers tonight, please don't give up and reach out to us.
Absolutely. And not to sound old school, but we also have a website. So you're welcome to jump on our website and connect with us that way. We love to answer your questions. We love to know what you'd love to see in our next webinar. We try to do one every couple of months, and we want to give you guys the information that you want. As I said, I really appreciate Poseidon, and I really appreciate KBC for actually providing this education. So I get to announce the winner of the prize pack, and that is Sarana. I hope I'm saying that right. McKellar from New Jersey. So congratulations, Sarana. You are going to get a gut reset and a beautiful leather head collar from KBC. And Sarana's still on. She won. Yay. Good for you. And again, I want to thank KBC. If you're in the Kentucky area or if you shop online, KBC can help you with all of your horse needs, whether it's feed, supplements, tack, brushes, fly spray, show sheen, anything that you need for your horse. KBC has been in business for over 35 years, and they're absolutely amazing. They have a fantastic staff. They have a fantastic range of products. So jump into KBC and you can try a gut health reset for yourself. So again, that's the stress pace for 3 to 5 days when you start the HP. And we want to give that HP at least 90 days to work. If after 30 days you feel like you're not seeing any improvements, definitely get in touch with our team, and we might need to be able to look at your diet or look at your management program, see if we can make some changes there. I also want to say we have a ton of information on our YouTube channel and on our website, so we might be able to answer a lot of your questions there. Thank you everyone for sticking with us. I know it was long. We'll try to make it shorter next time, but there's so much information to give, but we do appreciate you guys. Thank you so much.
Thank you so much for joining us, everyone. We really appreciate it. And thank you to the team for being on board, Dr. Claire, Dr. Tiffany, and Dr. Erin. I have the privilege of working with these people regularly, and every day we get to improve the lives of horses. And we're excited for you to take the information that you've learned and apply it to your own horses now. So thanks again, everyone.